Okay guys, back with another video for you. Oh, sorry, my hair's all ratty because I was out by the wind. It's really windy up here where I live. I said I wasn't going to make another video probably for you guys, but the shot worked. My hand's feeling better. I mean, it still hurts right here in this area where I got the shot, but it's better. The reason why I'm making this video is because my doctor just called me. And of course, it's not good or bad. It is what it is still, and it's aggravating. Okay, so with RA, when you're getting diagnosed with RA, they run a test. It's called the rythmatoid test or whatever. I don't remember the full name. It's something with rythmatoid something. Anyways, they take your blood, they run this test panel. And if were to be not having it, excuse me, not to have it or to be in the clear of it, you have to be a 14 or below. Your number needs to be 14 or below. I mean, you don't want it too low, but you don't want it too high. 14 is where you don't have it. Not even an indicator of it. 20, you might indicate for it. This is where it gets confusing because the doctor won't diagnose me with it, but I'm still reading the same numbers as I did since the very first test. And this is like 1, 2, 3, like 4 times he's ran this same test, and all 4 times my number comes back the same. And it's so aggravating because he's going to keep observing me for a whole year, but the point is, and he might go longer, he even said, because it concerns him as much as it is me, but there ain't much he could do because I'm marking off indicators. Like, there's so many of them I've already marked off for this that it's not even funny. And the one I keep marking off the most is my number. My number keeps coming back between a 24 and a 25, which means I'm very, very, very high for rheumatoid arthritis. If you have a number, anything over 14, you might have indicators for it. Anything from 14 to 20 are your indicators. 20, you could possibly have it. But 24 to 25, it's usually supposed to be a guarantee you have it. So he's not defying that I don't have the gene for it. That part he's saying I have. What we can't figure out is if I have it. And the only reason why this is becoming such a hard issue to figure it out is because when you have fibromyalgia and you have rheumatoid arthritis, you got to figure out which one it is. Because I told you guys in previous videos, they can mimic each other. Fibromyalgia can have the same effects. Flare-up, swelling, all that. Even the fire feeling, the heat in your legs. But the difference between them both is fibromyalgia is kind of like mental, but also like your body sends a mental signal to your body about pain. And that's where it gets all mungled and jungled. To where RA, it starts to affect the tissue and the muscle. And the part that he has to figure out is the part where I have to have a flare-up so he can see it, because that's the only time you're going to know for sure if this is RA. But what's frustrating is because if you look it up on any of your web pages or any of your websites, it will show you straight up that if you have a number of 24 to 25, you absolutely 100% have rheumatoid arthritis. My actual primary doctor told me I have RA. But because he can't actually per se or just go ahead and put it down like that, and that he had to do the next step, send me to a specialist. And then the specialist cannot mark it off because you got to have evidence to back up what it is. So now you know my frustration. I've been dealing with this for 10 years. And every time I get a diagnosis, I find out it's another diagnosis, and I just want to know I'm not crazy here. Because I feel like I'm going nuts. Because this thing has really consumed my body, and it affects my everyday life. And if I have both, I need to be put on a medication ASAP to correct what's happening. But then he said he doesn't want to put me on the medication because if I don't have a RA and I just have the indicators for RA, that could be bad. And not to mention it can mess with my fibromyalgia. Which, by the way, if you guys don't know, fibromyalgia, there is no cure. The cure is like you just got to get right with your mind. You got to start to eat right, exercise. Don't let yourself you could be in pain, but you got to keep yourself going. That's the problem with a lot of fibromyalgia patients, which I'm one of them. When you're in pain like we are, you don't want to move. You just want to lay there, cry, say, God, please make it go away. And you're begging for anything to make it stop. Well, I'm begging for this all to just stop. It's actually causing me more stress. And if you also know, it's not good for RA or fibromyalgia patients to be stressed. It could cause it to flare. Bad. Although, I should be fine in this hand if it's just a fibromyalgia flare. Because this is supposed to tie me over until July. Yeah. It does about 2 months worth. So, I will keep you guys updated as much as I can keep you updated. And maybe if you are an RA patient or you are also a fibromyalgia patient or if you've been both, please tell me what I could do differently. Give me some answers. Go to my Twitter page. Type me a private message. Tell me what I could do. I'm up for anything at this point because, I'm literally going insane. I cannot stop stressing, and I've been in miserable pain, and I know you guys already know if you are a fibromyalgia patient or an RA patient, you know the pain levels. It's unbearable. But we usually don't even complain about it, which I try not to. I literally usually try to just hold it in and not let anybody know exactly how I'm feeling. I just try to put a smile on, or I just try to stay in my room to avoid people because I don't want them to know how much pain I'm in. Like when my husband comes in and he says, "Are you okay?" I'm like, "Yep, I'm great." But he knows really deep down that I'm not great because he's my husband. He just knows me too well. And then he comes in and he'll say, "Are you just trying to say that so that I'll go away?" And I was like, "Yep." I'm just peachy. Just hanging out here, hoping to God it stops. And sometimes I'm sitting there crying with tears in my eyes, just begging for it to stop because that's how bad it could get. And there's some times where I can't even sleep at night because I'm in so much pain. So I'm sitting up in a chair crying to him, begging for it to stop. So it gets bad. So please, if you are any of those type of patients and you have figured out something to help manage that, please leave a comment on my Twitter page or leave me a private message on my Twitter. Please. It would be appreciated because I'm done being done with all this. And I know I can never be done with fibromyalgia. There's no cure for it. It's the only cure, which is not a cure, is to do what you were told to do. And I have the booklet, I have the steps, I have everything that the specialist has told me to do. But I've already been doing them. So that's what makes me think, maybe I do have RA, and that's why it's bad. Because he said if there was both, it could be pretty bad. And I think that's why I already have a diet. I'm already on a strict diet because I had gastric sleeve surgery. I'm already exercising every day that I can. Although I've had to pull way back from what I used to. I used to do 4 miles a day. Now I'm only doing 1 to 2. depending on my day. If I'm having a super good day, I'll try to push for 2. If I'm having a really super day, I'll try to see if I can't get a 3rd one in, but I try not to push too far, because if once you push too far, it backfires on me, and I end up being out for a few days, because usually my legs go out, my knees, my arms, like my shoulders, my elbows, my wrist, my hands, my feet, my ankles. Yeah. Pretty much anywhere you have a joint, it goes out. Even in my back. Lower back. So, yeah. Alright, guys. I'm done venting. I hope if you are one, you do comment on my Twitter page and let me know what you do that I'm not doing differently. Like, I even watch what I eat. I don't do the carbs. I know you guys probably saw all the videos where I was eating Peeps. Shouldn't have done that. But, in all honesty, I did not eat that many as it looked, because it was just one of each, and I only did those one time. Although it doesn't matter, my diet, I usually keep a strict diet, so that probably didn't help, because I normally do keep a strict diet. And I don't drink any soda pop, I don't drink any fizzy drinks, I only drink water. And I drink anywhere from 60 to 80 ounces a day, if not more. Sometimes I could get past that, which is usually about the equivalence of 80 is the equivalence of what I drink in the water bottles, is about 5 water bottles worth. Sometimes I could get up to 8 a day, but I have to be careful, because you could drown yourself from the inside, so I try to be careful of that, because my doctors get worried. They're like, don't drink too much, because you could actually kill yourself doing that. I'm like, oh, don't want to do that, but I get thirsty. And that was part of having the gastric sleeve surgery, so sometimes your body needs more water than you expect, but sometimes it don't. So, yeah. Alright, guys. Thanks for watching this video. Go like, subscribe, and follow my sons on their page by subscribing and liking their videos, too. They'll be at the end of this video, of course, like they always are. Alright, bye, guys.